Hello, so I'm back with another video with my RT shirt, Respiratory Therapy. I look drained, I look exhausted. Sorry, it's a rainy day, and I just felt like making a video. It's been a while since I've actually posted a video on here. I think the last video I posted was like of my first semester of RT school, and now I'm in my last semester. Yes, I will be graduating May 2021. Today is January 15th, 2021. And I can say, like, this program honestly flew by. Our class had some challenges, especially with COVID and the whole pandemic. We weren't able to go to clinicals. However, in 2 weeks, my class would be able to go into the hospital. Of course, we're going to have, like, take extra precautions because every patient in the hospital, you might as well say you're just walking into COVID. I don't think we're rushing me on COVID floors, but you don't know what kind of patients you're going to come in contact with. They probably don't know they have COVID before they go in the hospital, or they may get it while they're there. So our school is just trying to be very careful before they send us. But I'm just really excited to go back to clinicals because we haven't interacted with patients like since first semester. Like, it's been 16 months since I've been in this program, and majority of my time in the RT program has been online. So imagine that, taking mechanical ventilation online, pharmacology online. Like, you really have to be self-disciplined. I say, like, my grades are really good. Been doing pretty well, making my A's. Last semester I made 1B. But that's still a blessing because I feel like everyone has been going through it since this pandemic. And being in Florida, things aren't shut down. Like, everything is still open. So you just have to be mindful. I try to stay quarantined. I try to stay inside. But, you just have to find peace within yourself. And going back to school, like, today's Friday. So our winter break ends Monday. Was my first day back to school. Well, Monday classes were online. Then Wednesday I actually went to campus. We go to campus once a week. Yesterday I had class online, like a seminar class. Right now I'm taking community health class, seminars, and then clinical 4. So I just wanted to get on here and check in. And yeah, I just can't believe that in a few months I'll be taking my TMC. Like, that therapist multiple choice tests and that clinical SAMs. Like, it's unreal. It truly is. But I even signed up for Kettering. So my Kettering will be starting January 19th to the 22nd. I don't know how it's going to work out because it's kind of like during the same times I have class, but class is online. So I'll work it out. Just, yeah. Wanted to hop on here and let y'all know I'm still going strong in a respiratory therapy program. I'm excited to graduate. There's a lot of people who didn't make it in my program, especially last semester. We had a mock test, like a mock exam, a mock TMC exam. In the beginning of my class, I think it was like 26, 24 people. Well, we're down to 16 people in this program. 2 people didn't make it last semester, and that sucks because then they have to like wait a whole year just to get back in and start where they left off. And then we have another mock exam that's going to be in April, so that's kind of like nerve-wracking because if you don't pass this, I mean, they give you 2 attempts, but it's going to be different tests. But if you don't pass the mock, then you dropped out the program. Like, I don't like that. Like, I know I'm going to pass, but for people who like made it so far, that really sucks. Like, at least pass the program, and then when you take the TMC, you can retake it if you don't pass the first time. It just really sucks to sit there and come so far. This work is so challenging. It's so difficult. You have to be very self-driven and disciplined to like make it so far, and then one test can determine if you pass or not. So I'm about to get my focus on, about to go over some notes, about to study. Like I said, just wanted to check in. And send some positive vibes. But yeah, I can't wait to graduate. I'm never consistent on here or making videos, but I'll probably come back in a few months, who knows, and or even when I start when I go back to the hospital in 2 weeks, I'll probably come back and let you guys know how everything went. Plus, I like to just look back on these videos on my own and just see how I've grown. But yeah, that is all. If you're in the respiratory program, how is it going for you? If you're doing it during this pandemic, taking classes online, how is that going for you? Because I always watch Respiratory Coach. Respiratory Coach, he comes through. He breaks everything down. It's very helpful. I like to watch his videos on here. Like, yeah, it's been a challenge. But I know, like, once we graduate and we get into, like, the real world, it's not going to be like school. But I still want to consume as much information as possible. Because when we go out there, like, there's some people who previously graduated from my school at FSCJ. They previously graduated. They passed the TMC. They passed the clinical sims, and they're still not working. They say that my professor told us that some students still aren't working because they're waiting for the pandemic to die down. Like, what did you think he was about to get into? Like, I'm ready to start working, like, right now. But I know it's a shortage on RTs. I know, like, I'm excited right now. But who knows? When I graduate, I'll probably be, like, overwhelmed with things. But right now, I'm kind of, like, overwhelmed with this work. And I'm just ready to, like, get it over with and just go out there and start practicing. And actually be hands-on with things. That's the worst because I'm more of a, like, on-hands person, visual learner. So just doing everything online is, like, such a drag. Like, we would be in lab on campus and, like, be on mannequins and do things on mannequins. Like, in a few weeks, I think we're going to start doing, like, giving surfactant to the babies, like, the mannequins and everything. I don't remember the last time I had, like, real patient contact. Like, the last time I was in the hospital, the only thing we did was, like, patient assessment, heart rate, respiratory rate, breath sounds, pulse ox, SpO2, like, if you could have it. That's it. Like, we supposed to go in there and know how to do, like, ABGs. I never stuck a real ABG in RT school. These are things that we have not done yet. Not on a live patient. I don't know. We'll see. Everything will work out how it's supposed to work out. Class 2021 has been a struggle. But like I said, I've been making my A's. I've been making the grades. And I'm ready to really get out there and apply my knowledge and become the best respiratory therapist of my abilities. Thanks for listening and thanks for watching. See you guys later.